Welcome to our inaugural series, Dr. Talks Percussion. We're here in Oahu, Hawaii. My name is Michael Carey with Fitness Evolution 808. We're going to talk about the use of a percussion massager for chronic issues that you may deal with or somebody that you know, a loved one, may deal with as well. We're going to be talking about the different accessory heads as well as how to use them on your body. You may have a different percussion device, but just try to use what you have available and get the same kind of effects that we're hoping to give you today. And Doc?
Aloha, my name is Dr. Kai Moriguara with Prime PT Wellness Clinic here in Kaneohe, Hawaii.
Next, we're moving down to the shoulder. So different attachment here. So we have our air plug head. So the reason for that, we have a whole lot of bones all over the place. So that's where we need that extra bit of cushion to be forgiving because we don't want to cause pain and damage. So same thing, we're going to start off on just the first speed, test the waters. So that's where we're going from the deltoid tendon, working our way up, working our way back down. But to follow up on the air plug head, it is super important to be able to hit bone because that's where tendons are what anchor the muscle to the bone. Tendons get damaged too, and that's where we have to have healing and recovery of that too. So that's where even throughout all these different bony prominences, we're able to get the muscle and the fascia to loosen up, and that in turn promotes the healing process from the increased circulation. So that's where, now that we kind of tested the waters, we're going to increase the speed. So I have it here at 9. We have a much bigger muscle than the tiny muscles that we had earlier in the neck, and that's because there's layers and layers and the muscle's much bigger. We do need the increased speed to penetrate and be able to reach all those layers of muscle and fascia. We're going to be working with our bullet attachment. So for this, we do get quite a bit of penetration, and that's where we're going to be working right inside the shoulder blade. So I'm going to start off with the slowest speed, going to test the waters. So looking for those tight, stiff spots. So going to slowly increase the pressure. So as these tight, death gripping muscles loosen up, that's where we get the unpinching of our arteries and veins, and the increased circulation is what we're looking for. So from here, I'm going to just increase the speed a little bit because we're right next to the bone. We don't need much power for now. So we're going to be pointing out all the different muscles that we worked on earlier today. For our shoulders, we're working on the deltoid and rotator cuff. So same thing, running from the tendon to tendon, running back and forth, running back and forth. Similarly, with our bullet point, we're catching all these intrinsic muscles. Same thing, we popped out that shoulder blade, get all up in there, get all those tight muscles to loosen up, help with the flexibility.